Today's speaker is Dr. William Wall, who's a chiropractor here in town. And he is a member of our Lions Club, too. He says Wednesday's his busiest day, so it's hard to get away. But he will talk to you about what he does and how it can help you guys. Dr. Wall.
So like I said, I've been here since 2010. I've treated some of you guys in here. I'm actually a Lions member. It's been probably a number of years since I've been to a meeting. This meeting happens to fall on my busiest day and the busiest time of the week. And I haven't gotten to a point in my career where I can make that time yet, but I'm going to work on it. What I plan on doing today is giving you this miraculous speech about how chiropractic is just the greatest thing you'll ever experience and how much it really benefits you. And I don't really do a lot of speeches. This is not a common thing for me. I speak about chiropractic every single day, and it's so easy speaking to 3 people in a room in my office, and speaking to a large group of people is somewhat different. I'm sure that I still feel the same about it, but if I don't convey it the same, it's because I'm quite nervous. Now, I do perform music in front of people often, and it's no problem ever for me. So I'm going to try to keen on that, but I did not bring a guitar, so no singing, and I don't do a cappella. So you just get the chiropractic stuff today, maybe sometime in the future. When I sat down, when Dr. Shukan gave me a call about if I would do a speech, I'm happy to do it. I know it's something that I need to work on and really get out of my comfort zone, which is my office. And so I say yes. I talked to my wife about it, and she said, well, look on the internet and see what really inspirational chiropractors are saying. So I did that, and it was really inspiring. It's just, it felt very much like I would be saying something I wasn't completely certain of. So I thought to myself, well, how about I just say exactly what I feel and be as frank and honest as I can about what I do. Most people are somewhat confused about what I do. Is the chiropractor going to do some magic crack popping on me, and is it going to hurt? Is it going to be nothing? Is it going to be greatly beneficial? And it's really important to understand that what I do is a matter of mechanical movement. It means I make stuff that's supposed to work perfectly and isn't anymore work better again. It's not as miraculous. I don't take all your bones and put them in alignment. I don't take bones that are out of place and just put them in position. That would be pretty amazing. I do move joints. I make joints that are stuck move better. And it's pretty simple. Sometimes there are times when joints feel not aligned, or they feel like they're not perfect, and they're not. We might make them somewhat better, but more of all, we make everything move better. The reason this is important to you guys is, as we go through life, for the most part, we start off pretty much perfect. Our joints, our spines, everything works the way it should. And at some point, we screw that up a little bit. Maybe it's a fall on our butt or a twisted ankle. That heals and stops hurting. But our body is pretty well balanced with muscles and joints. And so you have certain muscles that pull one way and other muscles that pull the other way. And if these perfect symmetries get out of alignment, that pulls things incorrectly. These asymmetries then in turn cause other mechanical movement issues. So to sum it all up, we take joints, we try to find the lack of symmetry, we try to find the lack of movement, and we make it as symmetrical and mobile as we can. Now, what chiropractors treat, we treat what is called a subluxation. Now, this isn't a dislocated joint. This is a joint that has some dysfunction in it. Whether that means a joint that is mispositioned, or it means just a whole area of spinal segments that don't move well. We treat the entire body, all the musculoskeletal system, and we make all joints move better. But for the most part, people come to me because their back hurts, and I'm happy to help them feel better. This subluxation I was talking about, it's really just a fancy way that chiropractors say stuck. Joints that don't move well, joints that give some pain, and we try to make them move better. Now, when I spoke with my wife, well, she's like, you're just going to tell them what you do? And I said, yeah. I thought the most beneficial you guys could get for me, because most people go, well, I got back pain, maybe I should try the chiropractor. That's easy to figure out. But really the keys are to know when. I can go dig a ditch and I can feel my back hurt. That's one kind of back pain. Necessarily, I can't get up from a chair. That's a different type of back pain. So knowing the difference between the two and when is the real tipping point that says I should go try something. Physical therapy, chiropractic, go see my medical doctor and get medicine. All these things. So I'm going to kind of go over some of the 3 most common conditions I see in my office, at least the ones that come in, and kind of classify them for you guys so you guys understand what I treat for the most part. I treat everything from a toe to an ear, but most part, these are the most common things I see. Okay? So I'm going to start from the most common one, which will be generally low back pain. Now, when I say a low back problem, we have low back pain and then we have a back that's out. And I don't know how many of you guys have had your back go out, but you've got to have seen somebody whose back is out. This is a person who goes to stand up and can't straighten. They kind of walk forward and maybe they straighten up after they get going. They feel better, they sit again, they sit too long, they go to get up and they're stuck again. That is a back that I consider out. Now most people feel like it's their back that cannot straighten, which their back is not coming erect. But it's not their spine that can't straighten, it's their legs, and I'll explain that. There's a muscle right in the groin that goes from your spine right to the top of the femur, which is your thigh. This muscle, when aggravated by the nerves in the bottom of the back, these bottom couple segments, which happen to be the most commonly aggravated and degenerative conditions in our spine, if these nerves are not functioning well, then this muscle wants to spasm. Now this muscle, if you can't see my spine, goes from your spine to your thigh. This muscle lifts your leg. This muscle also stretches when we straighten up. So if this muscle wants to clench and you're sitting down, the muscle will tighten and tighten and tighten while your leg is up. So now you're sitting, maybe you feel a little sore, maybe you don't, but when you go to stand up, it will not let your leg come down, and that's when you feel the catch. So you walk, and maybe you walk it out, and that would be good, and as long as it stays loose, you can walk fine. But that muscle will try to spasm back up. What is happening is the nerves at the bottom of the back are being inflamed, and that pressure on these nerves is contracting the muscle in your groin. And that's when I say you must come in. You must come in so we can get that condition under control. It's fairly common. Now, if it's that alone and there's not herniated disc, there's not tons of arthritis, can respond rather quickly. Somewhere between 2, even 1 visit, up to maybe 3 to 6 visits. It's fairly easy to get under control, and it's not that huge of a problem. If there's a lot of arthritis, this is degenerative change, this is bone spurs, this is the stuff that comes with age, it is a little bit more difficult to get under control. I never treat a condition that's unresponsive at all for more than 2 weeks. If it's unresponsive at all, then things need to be done to assess further if this is a bigger issue. If it's a bigger issue as far as a herniated disc, something that needs surgery, something that needs something like spinal injections, I will tell you, I won't treat you for very, very long. There's no 90 visits over a year in my office. So that's the most common condition I see. It's fairly easy to understand. Most importantly is understanding how to move when having this condition, how to get rid of it, and things to do at home while I'm working with you is where I give you the greatest benefit of knowledge. Now, moving on past the low back, which most people think of when they come into the office, the second most common condition is the neck pain, the tension headaches that come in the evening. That's associated with neck pain. If you're having a headache that comes more than 3 evenings a week, then you must consider that it may be more related to your neck than other things, especially if it's coming on late in the afternoon. A normal tension headache goes along what we call the hat band. Okay? It may start in the back of your skull and move to the front temples. You can sometimes calm this down with Tylenol, even ice may help, and if you can keep it under control, it's not happening frequently for weeks, no big deal. But if it's happening frequently for weeks, you don't have to suffer with headaches every evening. Even if the commercial says for everyday headaches take Bayer or whatever, you don't have to take a medicine to, get rid of that tension headache. If anything, it'll just relieve the headache but not get rid of the tension. And you have to get rid of the tension to make it actually go away. The neck pain, if there's degenerative, just like the low back, if there's degeneration, it's a lack of motion, the muscles don't work well, and everything gets tense and causes pain. What's most important about understanding what's happening in the neck is the nerves that come out of the neck, they go under your collarbone, out your armpit, and go down your arm. If your hands are numb, you have to consider things like carpal tunnel and neck problems and shoulder problems. If your arm is numb, it doesn't mean you absolutely have carpal tunnel, and that's important. You have to be able to assess if it's coming from the neck, the shoulder, the collarbone, or the arm. And so when we have arm symptoms, we want to make sure that the neck is in alignment, it's moving well, it's functioning well, and the muscles around the shoulder girdle are working, rotator cuff, and everything around the collarbone. These nerves pass right behind the collarbone, and there's just not enough room there if these muscles are in spasm to go all the way down your arm without arm symptoms. So if your arms fall asleep at night, wake you up in bed, you have to stand up and shake them out, and then you can go back to sleep, then that's probably an issue with what's happening between your neck and your shoulder, which is very easy to get rid of if it's not a herniated disc. Now, the third most common condition I see is in the mid back. This is a condition where you have no pain, and then you have something stabbing you in between your shoulder blades, almost like a wasp sting. Of the three most common conditions, it's the one that can respond the quickest. It's not 100%, but it is one that, you may come in one visit and it'd be gone, and then we high five and you walk out and you say, he's the greatest. And we like those. But what happens is these vertebrae get in a misposition, and the thoracic spine, which is this area of your body, is like a cage. It doesn't bend like a snake, like the neck does in the low back. It's pretty stiff. So if something starts to get in an awkward position, these ribs where they attach don't really like that. And the rib itself and the capsule around the head of the rib can really give you some sharp stabbing and then cause spasm around those muscles. And it just stabs in your back and you don't know what to do. It's somewhat easy to get under control, and we manipulate the spine. We move the joints moderately, and they ease up rather easily. If you get a bad enough spot on one of those ribs, you can even get a sharp pain in the front, and this can be really scary. It will feel like a deep pinch right in your chest, and if you're not sure, you might think it's your heart. If you think you're having a heart attack, don't come to my office, okay? I don't treat heart attacks. But if you can move and it goes away, or you can breathe a certain way and it goes away, but you move back and it does hurt again, come on in. It may be that. If I look at you and think you're having a heart attack, I'll send you right across the highway back to the hospital, okay? But again, it falls right into that category of conditions that respond rather easily. These conditions are just functional conditions. They're not something that you have to live with. So the thing I really want to convey is if you have some of these pains, especially if you're starting to get to an age where you're giving up certain activities that you love or who make you who you are, you may not have to completely give up on these activities. Now, there's certain times I might tell you, I work with you and I say, hey, you can't do this no more. It's bad for you. Stop doing it. But if it's a passion for you, my goal is to make it be something that you can do as long as you physically can, depending on the activity. I'm not going to have you windsurfing or something at 90 years old. But if it's possible and it doesn't hurt, I'm not against it, okay? Really, when people come into my office, they come in with pain. They want to feel better. I treat the things I feel on their spine. I make things function better, and they feel better. When the joints are moving better, the spasm doesn't come. Weeks after the spasm, the pain shows up. So as long as I can keep your spines moving, you can keep moving and doing the things you love for as long as possible. I can't give you 100% you come in my office with a pain, I'm gonna fix it. But I can promise that I can give you 110% effort to do as best as I can to make it better. And I have pretty good success, and I've been here a long time. I don't do speeches because I don't have trouble getting referrals. And that's because of the way that I treat and the honest approach I have. There's no, you don't have to come to my office and worry about me putting you on 35 visits, without nonstop and pay me up front. I work in 2-week increments, and if it's bad, I'm going to tell you it's bad. And if I can't help it, I'm going to tell you who to see. If you have an issue that I can't help you with, and I try, when we hit that point where it's not responding the way I feel, then I'm going to tell you, we need to get you to the right type of specialist that is going to help you. And that's 100% fact. And so I wanted to convey all those notes to you and kind of give you the idea of, it's not as magical as some people make it sound. A lot of times, when I listen to all the videos of the other speakers, the inspiration comes from how amazing we align your spine and all the great health benefits you get from it. And you do. But it's so much easier to understand, especially here, that a lot of people have actual pain that can get better. And if I can work with you and make you feel like you're able to play golf or ride a horse or keep rodeoing or doing anything that you want to do for as long as possible, then I call that a success. And so that's really the idea that I wanted to do with you. As far as treatments, the fears of what's going to happen, am I going to come in and Steven Seagal you? Am I going to take a Jean-Claude Van Damme approach on your neck? Very often not. There's a lot of ways to mobilize joints. Remember, all I'm doing is taking stuff that's stuck and getting it working. It doesn't mean I'm going to be doing these really drastic movements. It's really just stretching and exercise. It's pretty simple stuff, but it's effective, and that's really the idea. And so, yeah, I hope I could kind of give you a better outlook on what we do, so it's not so confusing and mystical. Because I'm not faith healing, I'm actually healing through movement, and it's pretty simple stuff. So, any questions on what I do? Any ideas of if anybody's ever had any concerns or had any problems with other chiropractors or other types of specialists? Ask. I'd like to answer. Yes.
Do you take X-rays before you start your manipulation to make sure there's not something there that's going to...
Right. Absolutely. So when you come in as a patient, you're going to get a history and you're going to get an examination. Depending on how things move, risk versus reward with how you feel, images are always warranted. I always like pictures, but I don't order x-rays on everyone, no matter what. The movements I'm doing with you are not drastic. So often, if you're 22 years old that has some tension headaches or some pull muscle in your back, I don't need to shoot a huge bunch of x-rays at you and then tell you to come in a whole lot of visits. But we can work into the joints and get them moving better. Now, if we work with you in 2 or 3 visits and it's not responsive, we have to have x-rays. If you come in and it doesn't look like I can safely do what I want, or it doesn't feel like I'm feeling exactly what I expect, yeah, we must have x-rays. So I definitely utilize x-rays, but it's not in every single patient necessity. Yes?
If you're having issues like you described, can you treat them if they're not inflamed in that moment, or how does that work? So like the back issue being bent over,
Sure.
the back goes out.
Sure. Our bodies, if your back can get irritated, it often leaves these imbalances, especially if it does it reoccurring. Like if your back goes out, for 5 days here or there, and you're in your 30s, and then when you're in your 40s, it goes out every month, and then when you're in your 60s, it goes out every week, or it just kind of stays out. It doesn't have to be out, and you don't have to walk into my office like this. I'm treating you to fix your pain, but I'm not treating your pain. I'm treating the misposition, the stuff that's not symmetrical. So you don't even really have to have it in its worst state for me to find these asymmetries and these lack of motions. I just get it moving. And so if you were to come in and you say, well, my back goes out every now and then, but it's not right now, and I just want to keep it from ever doing that again. Yeah, you won't be treated really frequently, but you'll be treated, and we'll see if there's something there to manipulate. And if there's not, I'll tell you, go home. No big deal. Absolutely. Yes?
Hey, you treat like people have sinus problems in the head or stuff like that, maneuvering it to unstop those tubes?
So there are some techniques that are used to open up the sinuses. A lot of it has to do with the very top vertebra in the neck, the sinuses themselves. So there are some techniques that I'll utilize. Now, I won't treat somebody with a sinus problem for weeks. It's like a 2 or 3 visits, and if it's unresponsive, I send you to an ENT. But I will treat it. It's just not an ongoing technique.
What about vertigo?
Same thing.
Okay.
There's definitely maneuvers that can get rid of vertigo. All those are conditions, and there's hundreds of conditions that I will attempt to treat. It's just those conditions are the ones that most people come in for. The ones that are more like, hey, this may help, or this may not be of benefit, those are more techniques where we use them for like 3 visits, and if it's unresponsive, we step back and say, all right, do we need a specialist? Is there some testing we can get done? Do we need to involve other healthcare professionals? Anything else?
So I do have a question.
Yeah, shoot.
Because you had mentioned that depending on arthritis and things like that, so how does chiropractic care, is there benefits to someone that has like inflammatory issues?
Yes. Do you mean as far as arthritis?
Maybe.
Or is it
Well,
it's
just-
inflamed?
Yeah, just inflammatory, period,
Right.
any kind of
Well, there's different types of arthritis.
yeah.
Osteoarthritis means wear and tear or degenerative. I beat it up through my life. Then you have the other types of regional arthritis that is not have a lot to do with how you move, but it still affects how you move. I don't get rid of rheumatism, I don't get rid of psoriatic arthritis, but it still may affect how the joints move. And if you can keep the joints moving and keep the inflammation away from the joints, the arthritis may not progress as much as if they were stuck joints. I don't know how much time I have, but an inflamed joint may not necessarily hurt if it's just one joint. There's so many segments of our spine that other joints move well and take up the slack for the bad one. I see this often when somebody has a really great curve in their spine and they have one bad joint. They never hurt in their life, and then they come in with the most unbearable pain. I treat them a couple of times because they're generally pretty healthy and they're unresponsive. I get an MRI and it's the worst disc I've ever seen. And so because of that bad one disc, they finally felt pain. Whereas people who don't have good curvatures and they have lots of inflammation around their spine throughout their whole lives, this inflammation sits around these joints and deposits calcium around those joints. So I see that person and I shoot an x-ray of them and there's bone spurs all over the place. They have a lot of little bits of pain for long periods of time and lack of motion, but they might not have one disc that's really horrible. The same applies. I just make the joints move as good as they can. Maybe I can't make it move like it was when they were 17, but if you can get one joint wiggling 3 or 5 degrees, and you do that at 10 joints, that's a pretty good amount of motion. So, and not to mention just the better improved motion that you have, if we can make the joints move and the inflammation go away, it's possible that the arthritis or the calcium does not deposit around the joints the same way that they had already, and you may have less arthritis over the years. Okay? Inside of inflammation, and this is really a real key point, is inflammation has all this stuff in it. It's not just water. It has cells that build things. Their job is to build no matter where inflammation is. And it has all these building materials inside that fluid. So if this one joint has arthritis, or it has inflammation around it because you slid down a slide, didn't catch your feet, and hit your butt real hard, you may not have much pain, especially as your bruise goes off your butt, but that one joint may stay inflamed. And if there's a little bit of inflammation and it's just one joint, you don't even know it's tender. Now, if somebody comes behind you and pokes every one of these, one of them may be tender, and you go, well, that's weird, I didn't notice. But that inflammation, if it sits there long enough, those little cells that build, they grab those building materials and they just do their job. And they just put those building blocks wherever they can, and they form degenerative change, calcium, basically. Bone spurs. Just like if you cut your arm The inflammation comes, it turns red, and then over the next couple days, the hole, the scratch or cut just kind of comes together because those building blocks just started getting put down by those builders. And that's what inflammation does. And that's what I'm combating is lack of motion that causes inflammation, causes arthritis. It's pretty simple. I've gone a lot deeper than just, hey, you hurt, come on in, I'm going to help you. But there are great benefits. There's some things that you may also benefit greatly from that are more in theory. The nerves, they do apply to all the organs of the body. And this goes into kind of some of the talks that I heard on YouTube with the really inspirational chiropractors. What they do is they'll treat you for everything. You come in, you have gallbladder issues. They're going to adjust your spine at the gallbladder area, and they're going to help your gallbladder. Maybe, maybe not. That's why I don't really go there. But if you come in with back pain, and it's right at that area, and you also have some issues with gallbladder, and you feel like they're improving, then we'll high five and we'll say, hey, maybe that's cool. But no, I'm not going to tell you to come in for your, gallstones. Okay. All right. Any other questions?
Great.
All right. Thank you guys for having me. I appreciate it.